I came here today because I think I have a message, and my message is to empower people that you are in charge of your care, and you can be. I see too much in my daily grind, my daily work. I see people give away their power, and they don't understand, they don't know, they don't ask questions. And so I hear a lot that I know because I'm a nurse. I hear that a lot. And I'm out here to say, no, it's not because I'm a nurse, because I'm human just like you, and I have the same issues learning how to navigate. Learning to navigate COVID, do you think I knew that? I did not know that. We had to learn that. And just like I learned, I'm here to encourage people that they can learn too. I'll tell you, one of the biggest misconceptions with patients that I encounter is I was in a study. I did help do a study 10 years ago, and it was about Blacks receiving less treatment for strokes than whites. And when you look at that, you go, okay, Black people have more strokes than white people, right? So why are Black people being treated less than white people? So what the study revealed is that Black people come to the hospital later than white people. So it's still a lot about our control and what we can do. So in that study, it was 3,000 people in the study, and there were like 50% were Black and 38% was white. So there was more Black people had strokes. And in the people who got treated, it was 12% got treated. And in that treatment plan, 78% was white and 59% was Black. So how do you explain that more Black people had strokes but got treated less? And when we drilled down, it was simply the arrival time to the hospital. We are suspicious. What do you want? And I grew up in Roseland, in Chicago. My mother worked at St. Bernard Hospital. If anybody's watching from Chicago, knows that that's in the hood. And so I come out here so you can see me, so that you can see and maybe trust me that I came from where you are. So can I help you? I want to say this, one big difference about coming to the emergency room late, the other one is only coming to the emergency room when there's an emergency and not going to the doctor. So not that it's fair, because we know life is not fair, but then doctors stereotype those patients. You came here when you're half dead, and you haven't been to a doctor in how long? Your blood pressure did not get to be this high today. So it's been getting higher and higher, and you've done nothing. So are you going to be compliant? Are you going to take the medication? Do you care about yourself? Should I care about you? It's not fair, and I'm not giving doctors an out for being stereotypical and using a stereotype, but I'm just explaining why they stereotype, and we still have some control of that narration by not just showing up to the emergency room and never going to a doctor to seek care. At where I work at Advocate Trinity, when I was a stroke coordinator, we wanted to give a medicine that's hard on the kidneys, and across the system they gave this medicine because it's a contrast, so you can see what's going on in the brain, but it's hard on the kidneys. So they give it without any test. And I wouldn't let them give it to the patients at Advocate Trinity. And the reason is because our patients don't know they have kidney disease. They're diagnosed with kidney disease in the emergency room. They haven't gone to the doctor to know that they have kidney disease. So now you bring them in, you give them this contrast, and then later when you test and say your kidneys are failing, you did this to my kidneys. And it's not. You didn't go to the doctor to know. So we figured out how we could do a quick test real quick to see what the kidney levels were, and then give the contrast so that we know, so that we can arm them with, hey, you have some kidney issues. We gave you this contrast and we're going to help clear it out, but you have some kidney issues to deal with, because they don't know. I really want people to understand that they are in charge of their care. And if you don't have any goals, we can't help you get there. I want you to know that there's a team taking care of you, and you're a part of that team. and you have a voice in that team, and you have to speak up and advocate for yourself for the team to work properly. That's what I want people to know.